To start out tonight, my guest is Dr. Nick Abedi. You're a vascular surgeon with Fayette Surgical Associates. Got that right?
That is correct. Thank you.
All right. Now, we talk about varicose veins, vascular. There's arterial and there's venous. Tell us a little bit about the difference.
Yeah, it's easily confused by a lot of patients when they come in and see us, and they tell us that their mothers had problems with their veins and they want to be assessed. So, easy way to think about it is arteries are supplied outside of the heart to the extremities and to the organs. So that carries oxygenated blood. It's going outside of the heart. And veins are blood that's where the oxygen's already been used up, and it's going back towards the heart. So arteries are connected to the heart, and they do have a pump, so they're under high pressure. Where the veins, they don't necessarily have a pump, so they're under low pressure. And over time, each of those systems gets affected differently.
Okay, now, when the veins don't work, we call it venous insufficiency. What might be some of the symptoms of that to make you think, oh, I've got a little bit of a problem?
Well, I think I have some of those symptoms today. So after you're on your feet all day, what happens with the effects of gravity is that blood is constantly being pulled down towards your feet. And some of the symptoms are fatigue of your legs. It feels tired, it feels heavy, it aches, it throbs, and commonly it tends to swell. And the swelling is oftentimes more noticeable around the ankle and the calf area. And this is something that progresses over time.
Is there any specific risk factors or things that cause the veins not to work right?
Well, there are certain professions that have increased risk of that, and jobs where people are on their feet constantly without movement, or people that are in a sitting position. So you actually need movement as the pump mechanism to move the blood in the veins. So it's the calf muscles that actually help move the veins, the blood in the veins. So certain jobs increase the risk factor. Obesity is another risk factor. So if you're obese, the bigger you are, the harder it is for the blood to be pumped against that weight, especially in the abdominal area. So those are two risk factors. And especially in women who have been pregnant, it's usually during pregnancy is when a lot of veins get damaged.
So if you have some of those symptoms, how do you make the diagnosis?
Well, the first reason that the patients typically see us is for the symptoms we talked about. The first thing that we do is a physical examination. So if you see visible varicose veins, so those are large veins underneath the skin, that is indicative of an underlying problem.
Now you mentioned that too, and there's a picture up there. There's a difference between big varicose veins and spider veins.
Correct. So spider veins are directly inside the skin layer. They're very small. They're very visible, but varicose veins are ropier type of veins underneath the skin. And they carry a lot larger content of blood. And typically, both of those are indicative of an underlying vein problem, but they're treated differently. The way we assess the patient initially is with an ultrasound. An ultrasound is non-invasive. I describe it as a sonogram. A lot of patients understand when pregnant women get sonograms, it's the same way we assess the veins. So we assess the veins for two things. One, we assess it to ensure there's no blood clots in the veins. And then the other assessment that we perform in our clinic, which is a little bit more specialized, is we measure valves inside the vein. So all veins should have one-way valves. It should allow the blood to go back up to the heart, but as the blood tends to trickle down with gravity, the valve should close and prevent it from pulling back down towards the legs. When these valves become incompetent, which means that they're no longer meeting in the middle, blood tends to trickle down in the wrong direction. And we measure that with ultrasound.
So you got the diagnosis, you can do those tests right in your office. What's the treatment? What do you do about it?
Well, the first treatment I would like all patients to realize and perform at home is use of compression stockings. That's something that they can buy over the counter, they can buy it over the internet, or they can get a prescription from their physician. So knee-high compression stockings, I generally recommend at least 20 millimeter gradient. That's how tough they need, or the strength in order to allow the blood to return properly. That's the first line treatment. If patients have done that already and they continue to have symptoms of swelling, discomfort, then we can proceed with talking about surgical therapy. And surgical therapy is first identifying the underlying superficial vein that's causing it. So there's typically two large veins. By superficial, it means that it's not by the deep arteries and nerves. It's directly underneath the skin. We identify which one of these veins has the problem with the valves. And in the past, surgeons would treat that with stripping, which is really not done very often anymore. That was a more traumatic surgery in the past. We now use different therapies to cause the vein to prevent flow. And we use laser, which uses heat to burn the vein. We also use radio frequency ablation, which uses microwave technology to burn the vein. And now we also have chemicals that we can directly put into the vein to cause it to clot.
Well, that's great information. So if you've got problems with your veins, swelling, you can see a vascular surgeon for help. We'll be right back.